don't see a okay. So this is the eyeball. As I said, the cornea is the front surface that you can neutralize with scleral lens, but the back surface you can't do much. Front surface of the lens, back surface of the lens, media, and the retina. So these are, and plus you when you put a scleral lens, the scleral lens may also have some irregularities. Okay, so that can also cause irregularity. So let us understand the Zernike polynomials. First order aberration is tilt. Okay, the eyeball or lens, whatever, is tilted. That can be easily managed with the prism. Second order aberration is defocus, myopia, hypermetropia, astigmatism. So up to second order aberration, you're okay, you can correct with the spectacle. The moment you go into third order aberration, so that is where the coma and trefoil comes in. And that is very difficult to correct with the spectacle, right? Then fourth order aberration, refractive changes, multifocal contact lenses. I am using multifocal lens right now for reading. So that I have introduced a aberration in my eye so that I can get the reading also. But so that is to be considered when you are using the eye vision. That is where the eye dress machine comes in to measure and put this. So if you have something wrong with any of this, you are going to get glares and halos, and that cannot be corrected with a regular spectacle or contact lenses. So this is again to emphasize more. So this is a point spread function. So if you see a point, the point has to be just a point, not spread. But the patient with high order aberration or keratoconus or anybody who has irregularity on the cornea, they will see, if they have astigmatism, instead of point, they will see a line like this, defocus. So it is not a small point, it is spread. And these are the coma and trefoil. These are the most disturbing. See, with these two you can manage, you can make your life easy. But with the coma and trefoil, the patient just cannot manage. It is like he's always unhappy because wherever he's looking, especially at the lights, difficulty in driving in the nights because all lights are there and he will get all confusion because of those coma and trefoil. So this is the instrument. What happens is they have a array of rays that goes, and then whatever comes back they measure. If they come from the same hole, you don't get see, so that is no aberration. But if they get distorted, that is the aberration. So like this you can see. So this is the no aberration pattern, and that is the aberration pattern, and that is calculated and it is given into the form where you can actually cut it on the lens. So just to make it more simple, so this is the front surface of the cornea. That can be irregular, but that can be corrected with the lens. The back surface of the cornea, if it is irregular, you can't do much. The front surface of the crystalline lens, back surface of the crystalline lens, and the media and the retina. So there are two segments. Usually now, because of the oculus machine, they can actually differentiate what is aberration happening because of the cornea complex, back and front, or because of the lens, and that way you can decide what type of lens to give, how this can be managed. Okay, so just to make it more simple, what is it? So you can see a Pringle or a wafer. Have you seen wafers which are like twisted and all? So like that, if the cornea is becoming little bit of haywire. So if you look at that middle picture, you can see there is one portion which has gone up and another portion that has gone down. It's easy to understand, right? Here there are up, down, up. So this is, I have just shown you there how it looks. So what you can do is you can nullify those wavefronts. He explained here what is wavefront and all. So this is considered a wavefront, just like a sound wave. They have the noise cancelling headphones when you go in the plane or if you are a pilot or something. So what it does is, if you have a crust, you put a crease there and you can nullify. So the same principle is used, and these wavefronts that you have seen on the aberration aberrometer, you put a negative wavefronts in the front of the scleral lens and you can manage. Now to do that, the lens has to be perfectly centered. It has to be non-rotational. If your lens is not perfect, if lens is going to move here and there, you are causing more aberrations and patient will be unhappy. So what happens is, the lab will send you a lens like this, dotted lens. Whenever you do a scanning or anything, you have some pattern. So same thing, this is the pattern. So make sure the lens is whatever the rotation, and they will, once you measure with the OVITZ or AXL Wave, this is the OVITZ X Wave technology that right now I'm the only one in India who has this, because it is my American practice who has brought this. So it is my clinic in USA, they gave me. It's not available for India right now. But this is the machine, and this can give you the measurements. This is how the graph looks like. This is normal. If it is blue or yellow, the patient has some aberrations. See, this vertical trefoil is little more than that green line. So patient may have little problems. But if you see something like this red, the patient has a lot of aberrations, and patient is complaining of high order aberrations, glares and other things. Point spread function, normal person will see E like this, that patient will see E like that. Okay, so much of deviation. These are the numbers that is used for designing. So this is how the measurement is done. You put the data into the software, name, date of birth and other things, and use the. So ask patient to look in that red light, and the machine will automatically, just like auto ref, it will take 5 readings like that. So I think Abhijit is not in this group. Maybe this is the second batch. Yeah. So Abhijit has gone through all this stuff, so he is capable of doing high order aberration lenses. Only it is the cost which is prohibitory, so it is taking a little time. But if you have any patients complaining of that, you can refer to Abhijit and he will take care of it. So let's go in time out. I'll finish. So this is just one case because the scientific presentation cannot be completed without a case. 25-year-old male, right eye more than left, ghosting 618, 612, even with the scleral lenses. This was his graph. You can see vertical coma, vertical coma, horizontal coma, so much of distortion. RMS, that is mean square, is about 2.03. So we put a scleral lens. This is a left eye. Left eye is normal. So use these lenses. If you can see, that picture has some dots. And that dot you have to align, you have to tell the lab at what degree those dots are. And this is the improvement. Absolutely gone. Patient is super happy. This is left eye. So patient can be, improved, his quality of life is improved, and he can lead a normal life. As I just know, I conduct this certification program.